way, this gives the Australians and indeed the Canadians some new leverage that they can use in their discussions with China. For example, the Australian government has had a lot of difficulty of late actually even having a discussion with the Chinese government. So I can't imagine that situation is going to be able to continue for very much longer. So maybe it's a way of addressing these issues. I mean, I know that in international affairs it can seem hopelessly naive to think that engagement is the better way to address the problems that you have. But certainly I'm of the view that any way we can use to develop dialogue and understanding is much better than the alternative, which is building up arsenals and dare I say nuclear submarines. I mean, this development comes in an extraordinary time, really, because just in recent days we've had this new agreement between Australia, the United States, and the UK. But I think it shows a kind of a different way that China goes about building its partnerships in the region, through trade rather than through, military agreements.
An Indonesian court has ruled that President Joko Widodo and other top officials have been negligent in tackling air pollution in Jakarta. In a landmark decision, the Korti, ordered the installation of monitoring stations and other measures to improve the capital's air. The lawsuit was filed by residents in 2019 and the verdict has since been postponed several times. Air pollution is reducing Jakarta residents' life expectancy by 5.5 years. That's according to US researchers. Persistent smog in the city of 10 million people is caused by heavy traffic and coal-fired power plants that have not been fitted with filters. The district court has instructed President Widodo to improve the national standard of air quality, adding that the provincial government must conduct checks, such as periodical emission tests for older vehicles in Jakarta and outdoor air quality tests. Information, the court said, must be made public. Now, to end, as the Maori Party here campaigns to officially change the country's name from New Zealand to Aotearoa, we thought it appropriate to put together a very light history lesson and take a look back at other nations to have done so. Firstly, let's go back a couple of years to 2019 and the most recent name change from the Republic of Macedonia to North Macedonia. For decades, Greece and the Republic tussled over the name. Several Greek regions also claim the name of Macedonia. An agreement was finally reached and people in North Macedonia were generally pretty divided on the issue. Here's how comedian Vlad Ilic sees things.
Now, I'm from North Macedonia in the Balkans. Which is a country north of Greece. It's in the name, North. And don't confuse it with the region Macedonia in Greece. We have like a polite conflict over the name. Yeah? Like this is how it goes. We meet at the border and we go, we're Macedonia. And then the Greeks go, no, we're Macedonia. And then we both walk away unemployed.
In 2018, Swaziland changed to Eswatini, officially the Kingdom of Eswatini. This was a decision made solely by the King on the 50th anniversary of independence. The King said that whenever he went abroad, people mistakenly referred to his country as Switzerland. Sounds a little familiar with John Key's flag issue, doesn't it? Eswatini means land of the Swazis. The Swazis were settlers there. And when the decision was made, it did anger some who at the time believed the King should have been more focused on the sluggish economy. Here's African journalist and YouTuber Adiola Fayahun.
He now calls it the Kingdom of Eswatini. Can you just wake up and rename a country? I didn't know you can just wait. And what does that mean, by the way? Place of the Swazi? How is that different from Swaziland? Oh, because it has an English word. They don't want an English word because it reminds them of the colonial masters. Okay, what about doing something to better the lives of your people? I'm not saying that they shouldn't change their names. Many African countries change their names, but why don't we think about how to better the lives of people first? I'm just saying.
A few more examples. In 2017, the Czech Republic, of course, changed to Czechia, simply to make it easier for companies and sports teams to use the name on products and clothing. Similar reasons have led to other name changes in recent history for simplification or to mirror the most common local use. But the most frequently cited is the removal or addition of Republic from a country's name. In 1980, upon gaining independence, southern Rhodesia famously changed its name to Zimbabwe. Rhodesia comes from the country's former British colonial administrator Cecil Rhodes. The name Zimbabwe was locally historic and might translate as venerated houses, typically referencing the homes or graves of chiefs. The nationalist Zimbabwe National Party adopted the name in the early 1960s. And you can go back further from New Hebrides to Vanuatu thanks to independence, from Ceylon to Sri Lanka in 1972 to again move away from colonialism, or the flipping back and forth from Republic of the Congo after gaining independence from Belgium to Zaire, back to the Democratic Republic of Congo, mostly due to the preference of whoever led the country at the time. And of course the Congo River flows through the country. And that is World Watch for today. What do you think, Marnie? Interesting?
That was so interesting. What an amazing little roundup there. I hope that's going online. I think people will be interested to read that.
Obviously, moving away from colonialism was the most common reason.
Sounds familiar. I think, but Te Wiki o Te Reo Māori, I've really noticed the increase in uptake of the use of Aotearoa. So I feel like it's already happening, and what we tend to see each year, it just builds and builds and builds in terms of their interest in Te Wiki o Te Reo Māori. So, I think it'll stick. So we'll see where this petition goes from the Māori Party, but I feel like it's already happening, in my opinion.
Kia ora.
Kia ora. And that is Te Pūrongo o te Paututanga mō tēnei rā. Happy Friday whānau. Thinking of you all, and tā Miki Makoto will be back, of course, on Monday. Stay tuned. RNZ is about to cross to the Beehive Live to hear the latest on the COVID outbreak from the Deputy Prime Minister, Grant Robertson, and Director of Public Health, Dr. Carolyn McElnay. But for now, kia pai tō rā.
Te reo irirangi o Aotearoa ko ngā pito kōrero i te kōtahi kāraka ko Marama Tipole Aho. The Deputy Prime Minister, Grant Robertson, is about to hold a media conference on the COVID-19 response. We'll cross to the Beehive when that happens. The government will be keeping the school holidays in 2 weeks' time as they are, saying it would be more disruptive to move them. The school break will go ahead from October the 2nd, meaning Auckland parents still in lockdown could be facing at least 9 weeks at home with their children. The Education Minister, Chris Hipkins, says he wanted to give people certainty. He says teachers have been working through lockdown and need some time to prepare and mark assignments. The police are expected to reveal more details about a triple homicide in Timaru at a media conference due to start about now. The police were called to a house in Queen Street in the suburb of Parkside just after 10 o'clock last night. 3 people were found dead when officers arrived at their house last night, and another person was taken to Timaru Hospital where they remain. Superintendent John Price and Detective Inspector Scott Anderson are due to speak to media at the Timaru Police Station. The police have extended
Kia ora, ngā mihi nui ki koutou katoa, no mai haere mai ki hui papaho i te ramerei. Welcome to Friday's press conference, everybody. I'll very shortly hand over to the Director of Public Health to update us on the latest case numbers and several other matters as well. And then I'll provide a very brief update on economic support and on the Trans-Tasman bubble before taking your questions. Dr. McElnay.
Ngā mihi, Deputy Prime Minister. Kia ora koutou katoa. We are in the 5th day of Te Wiki o Te Reo Māori, Māori Language Week, and I hope you're all enjoying this week by sharing Te Reo Māori with one another. Kia kaha, Te Reo Māori. We have 11 new cases of COVID-19 in the community to report today, and all are in Auckland. That takes our total number of cases in this outbreak to 1,007. Of those total cases, I am pleased to report 549 cases have now recovered. Of our 11 new community cases today, 2 cases remain unlinked and are still being investigated further. There are also 5 new cases of COVID-19 in recent returnees in our managed isolation facilities, and details of those cases will be in our media release. I just want to take a moment to explain where we are at with the various subclusters in this outbreak. We classify subclusters as active, contained, dormant, or closed, based on the time since the last case associated with that subcluster was reported, and other factors like whether the case was a household member. That allows us to have an overall assessment of the situation and assess the risk. So active subclusters are cases which have been reported in the previous 14 days and are not household or other known contacts of previous cases. Contained subclusters have cases reported in the previous 14 days and are household or other known contacts of previous cases. Dormant subclusters are where there are no cases reported in the previous 14 days. And then closed subclusters is where there are no cases reported in the previous 28 days. So you go from dormant to being closed. We currently have 9 epidemiologically linked subclusters identified in this outbreak, of which 2 are active, 7 are contained, and 1 is dormant. We then have a further 10 epidemiologically unlinked subclusters. Of these, 2 are active, 3 are contained, and 5 are dormant. So what that tells us is that we are closing in around this outbreak and that we can be cautiously optimistic about the containment of it. I want to just touch on some information about the truck driver that was discussed yesterday. Public health officials are investigating the positive case announced yesterday in the Auckland-based truck driver. The truck driver and a member of his household have been transferred to a quarantine facility. I can confirm that he travelled in his work capacity to a number of supermarkets in Auckland, the Waikato and Bay of Plenty regions. You may have already seen that the first locations of interest related to this case are on the Ministry's website. These are in Mount Maunganui, and we are expecting further sites in the Waikato to be put online today, once confirmed. If you have been at one of those locations of interest at the relevant time, please follow the advice on the Ministry's website, as it does vary depending on the nature of the exposure at that location. We have been advised that he wore a mask and maintained social distancing while he was working. It's important to note that the supermarket the truck driver visited for his work are not listed as locations of interest, as they were delivery areas not accessible to the public. The company involved has immediately stood down staff who were in close proximity to the driver and have been assessed as being contacts following a risk assessment completed by public health officials. The company also advises their supermarkets have been operating under all COVID-19 protocols, including scanning or signing in, increased cleaning protocols, physical distancing and mask wearing. Truck drivers who come to the supermarkets are required to follow these same protocols and are physically distanced from team members who are loading or unloading goods. At no time do truck drivers enter the shop floor of stores or sites as part of their delivery or pickup routine. On testing, yesterday 7,400 people in Auckland took the opportunity to get tested, with around 1,710 suburbs taken from our 7 suburbs of interest. That brings our total this week for those suburbs to 9,200. In the past 7 days, more than 58,000 people have been tested across the Auckland region, and that's a huge effort. Testing also remains good across the motu, so thank you very much. Around 15,000 tests were processed yesterday, with a 7-day rolling average of just over 13,000. Just a comment on boundary testing. Police have started checking permitted workers crossing alert level boundaries and checking that they have proof they have had a test. We would like to remind all permitted workers, including freight drivers intending to travel through the alert level boundary checkpoints around Auckland, to ensure that you carry evidence to prove that you've had a COVID test in the past 7 days. Police will be asking to see that evidence. And I understand a number of vehicles, including heavy freight trucks, were turned around at the checkpoints overnight for failing to provide that evidence. Of course, permitted travellers, you can, just a reminder about where to get tested, you can go to any community testing facility nationwide or book in with your GP. Saliva testing is also an option. We do continue to see a big uptake in saliva testing, with 314 employers covering more than 3,000 employees signing up to use it. And since the start of September, we've had over 22,000 essential workers who have taken up the invitation in Auckland to have asymptomatic testing. All results from that testing has been negative. On wastewater, earlier today, ESR reported a positive test result detected from a sample collected on Monday from a catchment in East Auckland, which covers the areas of Pakuranga, Bucklands Beach and Shelley Park. A follow-up sample was taken on Wednesday, and we expect the results of that in the coming days. With hundreds of recovered cases associated with this outbreak returning home, we do expect to see detections in wastewater across Auckland, because we know that recently recovered cases can continue to shed the virus. However, wastewater detections like this do reinforce the importance of testing to err on the side of caution. So we really want to encourage a high turnout for testing. As always, we always investigate any positive detection and do repeat samples and see if we can match it up against known cases that are in the community, that have been discharged to the community. On contact tracing, there are now 1,064 active contacts being managed by our contact tracing team and public health units across the country. Of those, 94% have been contacted, 88% have been tested. And public health units across the country continue to follow up people in their areas who have outstanding test results. Just on the MIQ stay, I just wanted to make a point of clarification about the length of stay for community cases in our managed isolation or quarantine facilities. It has always been the case that people arriving in New Zealand from overseas have to stay in a managed isolation or quarantine facility for a minimum of 14 days. This has not changed and continues to be the case. For community cases, so cases appearing in New Zealand, identified in the community, for those that are sent to a managed quarantine facility, their stay has been a minimum of 10 days from the onset of symptoms or a positive test if they remain asymptomatic, including 72 hours of being symptom-free, and they meet the criteria for release from isolation as determined by medical officer of health or health practitioner. This continues to be the case for those who reside in a community that is at alert level 4, such as Auckland. The reason for this is that the lockdown restrictions reduce the risk of any onward transmission, and the risk to the community is considered to be minimal. On the 31st of August, we strengthened our guidance in the light of Delta for the length of stay for community cases to 14 days. And that is currently what the other DHBs who are in alert level 2 are following. And just to reiterate, throughout this outbreak, Auckland Regional Public Health have been managing cases in accordance with clinical judgment. Lastly, I just want to acknowledge the police and thank our police staff across the country who are continuing to work with our communities to keep New Zealanders safe and to feel safe, particularly in these uncertain times. And as an example of that, as I mentioned earlier, the work that the police are doing at our northern and southern checkpoints, at our MIQ facilities and across the Motu, the work that they've been doing is outstanding. And it is critical that at this time that people adhere to our alert level restrictions, because we've seen that has worked to get us to where we are and will continue to work to get our numbers down even further. So kia kaha. Back to you, Deputy Prime Minister.
Ngā mihi, Dr. McElnay. This morning at 9 a.m, the third round of the wage subsidy and the new resurgence support payment opened for applications. I'd like to remind businesses and sole traders that they can apply for the wage subsidy regardless of where they are based in the country, so long as they meet the eligibility criteria. As of this morning, 480,697 applications for the wage subsidy have been approved, totalling almost $2.1 billion in payments. The resurgence support payment, as you know, is aimed at supporting businesses to meet their fixed costs. As I announced on the podium last week, that payment was originally a one-off payment per outbreak, but we have agreed to make it a 3-weekly payment in recognition of the pressure that businesses are under. The first round of the resurgence support payment has so far paid out $563 million to 184,901 applicants, and this takes the total economic support paid out in this outbreak to almost $2.2 billion. As you know, we hope to see Auckland stepping down to Alert Level 3 next week, and this will mean a lift in economic activity. Based on what occurred last time we were moved from Alert Level 4 to 3 and then down to 2, 85 to 90% of economic activity is possible at Alert Level 3. To put some numbers around that, the Treasury estimates that the current scenario, with Auckland in Alert Level 4 and the rest of the country in Alert Level 2, is costing the economy about $700 million per week. But with Auckland in Alert Level 3 and the rest of the country in Alert Level 2, the cost of the economy would be around $260 million per week. As the Prime Minister indicated yesterday, if on Monday we confirm our in-principle decision for Auckland to move to Alert Level 3, we will also be considering an increase in the number of people who can gather together, including in hospitality venues around the rest of the country, and we anticipate that this would be lifted to 100 people. I know that will not solve all of the issues for the affected businesses, but I know it is welcome news for many, particularly in the hospitality industry. And to the cafe bars, owners, venues and staff there, thank you for doing the right thing and helping us through this outbreak. I know that it has been tough, but we are heading in the right direction, and we couldn't have done it without the cooperation from everyone involved. And finally, an update on the Trans-Tasman bubble pause. The initial 8-week suspension to quarantine free travel with Australia is due to end next Friday, the 24th. The Cabinet has agreed to extend this pause for a further 8 weeks, and this will be reviewed again in mid to late November. We're announcing this today so that people in Australia can take part in the MIQ room release on Monday and have the opportunity to access the first tranche of around 3,000 rooms. Flights from Australia will be in October and November. Travellers from Australia should visit the MIQ website to find out how to participate in the room release on Monday. In addition to that, a third managed red flight from Australia to New Zealand is also planned for those in emergency situations, and this follows on from the 2 red flights that returned stranded Kiwis home to New Zealand on the 5th and 15th of September. Obviously, with those flights, the costs and MIQ costs need to be covered by travellers, and they need a pre-departure test from an accredited laboratory, which is required within 72 hours of travel. Happy to take your questions.
Just in regards to the 10 versus 14 days, if it's always been 10 days, why does the welcome pack for the community cases in New Zealand say that if you have tested positive for COVID-19 in the community, you'll generally be required to stay for at least 14 days?
Often it becomes it's a mathematical issue by the time people, because these are cases that we're talking about, so they have symptoms, they have to be symptom free, and they have to have a minimum of 10 days. And usually what we find, the feedback that I've had from the medical officers of health across the country is, in reality, very, very few people would be less than 14 days, because often what we're seeing with COVID is the symptoms persist, and it's the combination of the 2 factors that needs to be taken into account. So that's probably, just to be simple, why the welcome pack says that.
And I just think it's important to note that all these decisions are taken by clinicians on the basis of the health of the people concerned. Nobody is being released until a clinician believes that they're in a position to do so.
So why did you let everyone believe that it was 14 days when it was only 10?
Well, I don't think that is the case. I think you've heard now from both Dr. Bloomfield and Dr. McElnay in the last couple of days what the situation is. Benedict.
Do you have any more information on the numbers being turned around at the border? You said including some heavy freight got turned around. Do you have more details?
I believe the numbers we heard earlier this morning was that it was around 10% of people who had been coming to the border had been asked to go back and get a test. That's perhaps not unexpected on the first full day as people are getting used to the situation. And it's worth bearing in mind that we've established, particularly at the southern border, we've established the ability for people to turn around and go to a very nearby venue to get their test.
10% in perspective?
I'm sorry, I actually don't have the total number, Benedict, but it's a relatively small percentage. And as I say, I think on the first day of this, we're wanting it to bed in. I think perhaps one or two of the issues here might be around whether, not so much whether someone's had a test, but whether or not it's within that 7-day period. And so, but we are offering, as Dr. McElnay said, plenty of opportunities for people to get tested, including a site adjacent essentially to the southern border.
Is it fair that the Silver Ferns were granted a travel exemption out of Auckland when other people haven't been?
Yeah, so that's a decision that the Director General of Health made, and I'm happy to get Dr. McElnay to comment on that if she likes. The Director General looks at those sorts of cases, and my understanding from what I've read is that he considered that given that it was an international sporting event, it represented only 4 people, they had been tested, it was low risk, that it met the threshold. It did come via the business travel rather than the personal travel exemptions because it's supporting Netball New Zealand in one of their most significant matches that they're playing this year. But I do want to stress that's a decision the Director General takes, completely independent of government. Did you want to?
No, I haven't been involved at all in that, other than to say that there is a process, and yes, it is the Director General.
Mikey,
People might look at that exemption, people that haven't been able to, for instance, travel for funerals or to see the birth of their grandchildren and look at it and go, why is a game of sport more important than that?
Yeah, look, I accept that for people in those situations, this is a very distressing and difficult time. I'll just reiterate that the process by which this application has been made is via the business travel exemption, of which there are many, many people undertaking that. We discuss them every. I know, but
it's like to get food across the border.
It's a range of reasons why. It's not just to get food across the border. There are a range of reasons why people go through that process. But I reiterate again, this is a decision the Director General makes. We have to trust his judgment in these matters. He's made the judgment that this appears to be safe. Mikey.
Just another sporting question for you, Minister. Is the offer for Team New Zealand for the next America's Cup now definitely off the table, or is it still available?
So we've been clear that the extent to which the government believes that it can put resources in, that wasn't deemed to be enough when we made that offer initially. We would be happy to have further conversations around whether or not there is an alternative proposal where the government's contribution would be deemed to be sufficient to support it staying in New Zealand. So we're open to conversations, but we've been very clear with Team New Zealand about the extent of the contribution we could make.
How much extra could you pour into it, even if you could provide a percentage?
Well, no, it wouldn't be any extra beyond what we've already suggested we would be able to make available.
Do you have any just on the Trans-Tasman bubble, given that Australia is now considered to be in that high-risk camp, is it kind of providing, I guess, hope that's not really there to just suspend it for another 8 weeks? Because the reality is that pretty much Australia is now in the camp of every other country who's going to be assessed based on vaccinated travel next year, which may or may not get pushed out beyond the first quarter. So why, I guess, give that sort of hope with Australia that's not really there?
Oh, look, I think what we want to do is see where we are, both countries and states within both in Australia, around where we are on vaccination rates in 8 weeks' time. And it's, to us, appropriate to continue to review it. Obviously, what we have at the moment in Australia is certainly in at least a couple of states uncontrolled outbreaks, and in another one that they're struggling to control. And so for now, we think this is the appropriate position to be in. But let's see where we are in 8 weeks. But I take the point that you're making, which is that, it would be standing here today, right now, somewhat unlikely that in November we would make a quick decision. But, we want to continue to have the ability to assess it.
With that first quarter of next year, has any more recent sort of assessments been done by Cabinet around how likely that's looking given the data
For the
here.
bubble.
For the vaccinated travel that was
I see what you mean.
done in terms of the reconnecting.
Yeah, look, I mean, that plan remains the plan, but we, as has been suggested in the last week or two, we continue to update and look at that in light of vaccination programs in particular. And you would have heard the Prime Minister say yesterday that we've got ongoing work underway around the framework that we're going to be using over the next period. So we're still working towards the first part of next year for that plan, but we're constantly looking at it and thinking about how it might be tweaked.
Last clarification, I promise. The red flights, the two that ran already in September, or one's running this week, were Sydney to Auckland.
That's correct.
So, because the press release and you're talking about Australia as a whole, are you suggesting that people who are stuck outside of New South Wales need to get to Sydney, which sounds like a ludicrous idea?
Yeah, I think that will be a challenge for those people, but that is something we're going to be working through with authorities and with the New Zealand side. As I say, that's something we're going to be working through. It is obviously a significant challenge for people to be able to get from outside of Sydney into Sydney. But for now, those red flights have come from Sydney, that's correct.
Continue the bubble, on the bubble.
We'll just take Ben because I know it'll be about Australia.
Yes, the great country of Australia. The key question remains, I think, the same one as yesterday. Will you assess states, state by state, or the whole country? Because if you're going to do it the whole country, that's effectively the ball game, because New South Wales cases are going to remain in that red zone, aren't they?
Yeah, so I mean that's, I guess, was part of what I was answering to Joe, was that one of the things that we might be able to assess as we move forward is whether we could return to a state-by-state approach. As I said yesterday, I think that's not on the cards at the moment because, well, the thing is that's one of the reasons to keep the 8-week process going. But I take the point that has been made here that sitting here from the perspective of today, it doesn't feel like a very likely outcome that we would start again in 8 weeks, but we want to make sure that we've got the ability to reassess it then.
In the months leading up to the original opening in April, there was months and months and months of the Prime Minister, everyone from government saying, we want to do this, we want to do this. Now you've done it, it was tortured, and Kiwis have actually given their full feedback on it. I think it was 27% of people think it was the right thing to do to open. Does that influence you? Do you want to open up as much as you did prior to April?
The decisions we make about everything in COVID are led by a health response and a health approach. Bear in mind, in the early part of this year, we weren't discussing Delta. We were discussing a different environment, and as Dr. Bloomfield has said from time to time, almost a different virus. We have to look at the situation as it is now, as opposed to looking at the situation in April through the lens of as it is now. So my view is that we made the decision on the basis of advice and evidence at the time. Now we have a different situation, and we are pushing out for another 8 weeks, and we'll reassess it then.
Can I just ask, are you enthusiastic as you were before? Because obviously we've got some holidays coming up, we've got Christmas coming up, hundreds of thousands of Kiwis back at home. Do you have the ambition that they might be able to spend time together at Christmas?
It is a very different environment now than the one we were in then. As you know, we have a desire to get New Zealanders vaccinated, and then once we do that, that opens up a series of options for us. I'm not going to preempt any of those today, but the more people we get vaccinated and the quicker we get them vaccinated, the more options open up for us for that period of time. I'll come here.
The Herald today launched its 90% project for vaccinations. Do you think this is an ambitious target, and what would it take to get there?
I'm really excited about anybody who is promoting the idea of New Zealanders getting vaccinated, and as many New Zealanders getting vaccinated as possible. You know that we as a government haven't set a target, and you know the reasons for that. But you have also heard from various modellers in the last few days that 90% plus is of course where we need to aim for, the plus being an important part of what those modellers are saying. So I welcome any campaign that'll get people motivated to be vaccinated, and we want to make sure that we get not only to 90%, but we get above that as well. Do you want to add anything to that?
Just to say that the health advice has consistently been as many as possible.
We'll just...
And the health advice 90%, no? The Director General said yesterday we need at least 90%.
At least was the very important word in the phrase there, and the Director General, no, and we haven't had a firm piece of advice around a percentage target like that from the Director General. The point he was making was at least 90%, and I welcome campaigns that support anybody to get vaccinated. I'll come back over here.
Do you have any more information about the case that was identified at Middlemore Hospital that was reported yesterday? Have they been linked to the wider outbreak, and if not, how concerning?
I don't believe they have actually been formally linked to the outbreak. Interviews are ongoing at this stage, and
that's right.
Yeah, and I think the interviewers, the public health officials, continue to believe that they think they will be able to link it to the outbreak, but they haven't been able to do that yet.
And can you clarify that the truck driver, the Associate Health Minister this morning said that they were the cases identified through surveillance testing, but yesterday it was reported that they were picked up because they're a contact of an existing case. Can you clarify how exactly they were identified as a case?
Yes, they are a contact of a case. That case was recently discovered case. That case was symptomatic, and this person was then tested as a result of that person having been tested.
And I believe perhaps where some of the confusion may have arisen there was that this person had previously tested earlier on, and so I think that might have been, but the Director of Public Health is correct, it was a contact of an existing case. I'm just going to go up across the top. Mark.
A clarification about the 10 days, 14 days thing. If someone enters the country, goes into MIQ, and on day 01 tests positive, they go to the jet park, they are asymptomatic the entire time, they have to stay there for 14 days. If someone in the community tests positive, they are asymptomatic the entire time, they go to the jet park, they have to stay there for just 10 days. Is that right?
That's for the community cases. They're not subject to the legal framework that is in place for people coming into the country. So it is very much the decision of the medical officer of health, and that assessment is made. If they're deemed to be low risk, as I say at the moment in Auckland on alert level 4, then they're going home to a very safe, contained environment should they be discharged.
It is really important to keep reiterating that it's not like a target. It's about the assessment that is made by a clinician dealing with a specific patient, looking at their symptoms, looking at their history. And so while the rules are as they've been explained by Dr. McElnay today, these are clinical decisions which bear in mind the health of the person and the safety of the community. Mark?
It seems like you could have two people with the exact same clinical conditions, but one of them will have to stay there for 14 days as a result of having recently entered the country, and someone who was infected in the community could be released after up to 10 days.
I think when you're dealing with any situation, any case, you have to assess each case on its own merits, and that's why, as the Deputy Prime Minister says, these are clinical decisions that are taken by the Medical Officer of Health, which they are able to do.
Sorry.
Clarification on that. You said 10 days if they're entering level 4 Auckland, but if Auckland's not in level 4, will they stay 14 days?
Well, we're having those discussions with Auckland Regional Public Health as to what should Auckland move, and we obviously don't know what will happen, but we're talking with them around the implementation of that policy going forward.
So as soon as Auckland moves out of level 4, that will be strengthened though, because you introduced 14 days for Delta, you're in the middle of a Delta outbreak. If the level 4 restrictions aren't in place, then it becomes a risk, doesn't it?
We want to make sure that we've got tight management of anyone who might be infectious in the community, and so that's part of the conversation that we would have.
I think the bottom line is that this will be subject to further discussions with the Auckland Public Health Authorities. Sorry, I did say to Charlie, sorry, Jenna, you've had quite a few.
I'm just very good at throwing my voice.
Yeah.
So in terms of just some clarity around the time frame of of this truck driver being tested, what was happening in terms of, because if it was a household contact, would they have been isolating, or can you just outlay the time frame of that person being found and the truck driver being tested and then going off to
I don't have that information with me. I don't know if Dr. McElnay does.
Only in that I'm aware that a person in the household was symptomatic and went and got tested, which is exactly what we want to happen. This truck driver was a household member. They too went and got tested at the same time in advance of actually being told that they were potentially a contact of a case. The results of both came back positive.
And prior to that, some time prior to that, they had been tested independently of all of that. And obviously the locations of interest we're dealing with fell in the middle of that time period.
So this isn't a case of them being tested
and then going out.
No.
Just a banking question.
Yeah, we'll just do Janae and then come down to you.
Retail banks have been hiking their interest rates because they expect the Reserve Bank to hike rates. But I'm just wondering, are you comfortable with them doing that when actually they still have access to a whole lot of cheap funding, partly via the Reserve Bank's funding for lending program?
I'm pleased Henry's not here. He wouldn't approve of all of these non-COVID questions. But at this stage, those decisions that banks make, we never intervene or interfere in those. They make their judgments built on, their assessment of the interest rate environment that they're in. Clearly, the Reserve Bank has not changed its rates, but it would not be unusual for trading banks to predict what they think might happen.
The retail banks have received a whole lot of support over the past year and a half, largely from the Reserve Bank, but through a whole bunch of policy measures, which is in the large part good because we don't want banks to fail. But they're also now reporting very large profits and hiking these rates ahead of the bank. I mean, is this something you're comfortable with?
Well, there's always big questions in the public debate about bank profits. What I do know is that over the course of the last few weeks, I've been in regular contact with banks, and I know from what they're telling me that they are treating sympathetically those customers who come to them and ask, for example, for mortgage deferral or other ability to alleviate financial stress. They are continuing to listen to those people and respond to them. And right now, in the middle of this outbreak, that's what I would like them to do.
On the two unlinked cases recorded today, did they present to Middlemore Hospital last night?
I believe that they did, yes. They are one household, and they did present there. It's good that people are coming forward when they're feeling unwell, and they're being dealt with there, and obviously it's early days in terms of a case investigation and whether they can be linked up.
And to clarify, they had COVID symptoms as a result?
I believe they were brought in by a family member, and they were brought in because they were unwell, and then the testing was done. They were dealt with through the protocols as if somebody had COVID when they came in. Yes.
Thank you. Deputy Prime Minister, do you have a message for the community of Timaru who have been sort of really shaken by this, the tragic news overnight?
Look, it is an absolutely tragic event, and it'll be distressing not only for the people of Timaru, but also for the immediate people associated with the family, and so our hearts go out to them. This is a live police investigation, so I'll limit my comments, but other than just to say that the reports I've read are tragic, and my heart does go out to all those around them and their community.
Michael May, have you seen the recommendations from Auckland University that the Ministry of Health needs to start an education campaign about the correct way to use masks, and what do you make of that?
I haven't actually seen that report, but we would certainly concur that wearing a mask, wearing it properly, is really important. And my, observation of people not wearing them correctly would agree that there may be issues with people not knowing how to wear them. A mask is only as good as you actually wearing it properly, so covering your nose and your mouth. So we'll certainly look at that report and see if there's anything that we can take from that to put into our education campaigns.
What are you seeing in terms of the incorrect use of masks?
I think we're probably all seeing a number of people with masks sitting with their nose not covered, sitting underneath their nose. I'm just scanning to see if anyone's in that situation at the moment, but you do have to cover your nose and your mouth.
Experts, though, they're calling on the Ministry of Health as well to put out better guidelines in line of Delta. They say you haven't done that since Delta came out. They believe everyone at MIQ should be wearing N95 masks, including people in MIQ and the workers and at borders. And they also say the ministry should be giving out guidelines that cloth masks need to be at least 3 layers to do the job properly as well. I mean, is it time for you guys to put out new guidelines in light of Delta?
Well, we certainly have updated the guidelines and the requirements in the MIQ facilities, and there's an extensive use of N95 masks. So that certainly has been done, not just in the light of Delta, but in the light of emerging stronger information about aerosolization of the COVID virus. We continue to look at the information that we've got on our websites. I mean, I think it is important that people wear masks properly, that they do wear them where they're encouraged to wear them. And also it's important that if you're wearing a reusable mask, that you do keep it clean.
Charlie.
I apologise for the sensitivities around this, but there have been reports in the media about this family in Timaru who'd recently come out of MIQ. Do you have any further information about that?
I don't, and as I said earlier on, the police are still doing their investigations, and as you would expect in those situations, we don't tend to comment in any detail on that. Katie?
How is Auckland tracking in terms of vaccination? The Prime Minister said earlier this week that there was space for 200,000 people to get vaccinated this week. Is it on track to hit that target? And what will be your message to Auckland?
My message to Auckland is get vaccinated, and you've heard from the Prime Minister a couple of times this week the opportunities to do that, both through booking them vaccines, but also through the drive-thrus at the airport and at the Trust Arena. The numbers I do have is that 73% of our eligible population across the country have had their first dose, and with bookings that gets us to 78%. We are well on our way here, and we need all New Zealanders to take the opportunity to be vaccinated. We do know in Alert Level 4, we're asking people to stay home. There aren't many reasons that you can leave your home, but one of them is to get vaccinated, and so it's an opportunity for all Aucklanders this weekend to do that.
Do you have any figures specific for Auckland?
I don't have any with me today.
And we do have them, but I don't have them here. So
sure, we can get them to you, Katie, anyway.
The National Party is calling for the loss carry-back scheme to be extended. It says it wants to allow losses to be carried back 4 years versus 1. What are your thoughts on that?
Yeah, it's not something we're considering. When we brought in the loss carry-back scheme, it did not have particularly large take-up from businesses. And so at this stage, it's not on our plan to extend. It's not something I'm hearing a great clamour for from the business community. As we've shown throughout COVID, we'll always adapt and change our policies, but that wasn't one when we put it in place that had a great take-up. Joe?
Can you give us a date when interest deductibility, when the draft of that will be released?
Very, very soon. I don't have a specific date, but it's not far away at all. Joe?
Can I just get some clarification around what the alert level structure looks like now, and particularly, I guess, with Auckland looking to hopefully move down the... Is it a case of, going from 3 to Delta 2 to normal 2 to Delta 1, and everyone needs to do that, so Auckland would need to do the same? What's the progression scale actually look like?
Yeah, so obviously the first stage in that is the decision that Cabinet will make on Monday, and if we reconfirm the in-principle decision, it's alert level 3, as we know, alert level 3. Whether or not then, if we make good progress, the next move would be Delta 2 or the more traditional 2 is a decision still to be made. What the Prime Minister was indicating yesterday is that with Delta, alert level 2 effectively has rungs, and the top rung was the one where we had the 50-person limit. We're looking to move that for the rest of New Zealand to 100. We're still a wee way away from a decision that we would make about Auckland moving into that. And as the Prime Minister said yesterday, we want alert level 1 to be alert level 1. Sorry, we'll just take a few more. Yep.
Thank you. So the Privacy Commissioner has today warned that people are getting personal information from paper-based contact tracing systems and using it to breach people's privacy. Does the government plan to do anything about this, especially considering people more likely to use the paper-based systems are people without smartphones, maybe older people who are already quite vulnerable to these sorts of things?
Yeah, look, that's absolutely something we will be needing to follow up. We encourage businesses and organisations to provide an alternative to scanning, particularly for those who obviously don't have smartphones. We would ask anyone who's providing that to do it in as secure form as possible, for example, keeping it on the counter or near the counter. But I do think it's worth us following up to see whether we need to issue any further guidelines around that.
Do you have any idea of the scale of the demand for the emergency route flights from Australia?
I'm trying to recall how many people were on the last one that we did. 93, thank you. Actually, I'm not sure if it was quite that many in the end. I think 93 might have been booked, but not all of them showed up. So, yeah.
So you're getting a lot more sort of applications and people coming forward. And can you give sort of an idea of what the threshold is for people to get on that flight?
Yeah, so those red zone flights, the eligibility criteria, you've got to be a New Zealand citizen or a holder of a residence class visa. You need to have last departed New Zealand after the 5th of April, and there can be relevant family members of those listed. It does need to be in the category of being an emergency situation. Obviously, being very specific about that criteria is hard because everybody's got their own versions of an emergency. But I don't believe I haven't heard any examples of people feeling that they fall just a little outside the emergency. But it does have to be that you can't continue to look after yourself in a way that is appropriate in Sydney.
Can I ask
We'll just take these two.
In what format or how did you reach the Trans-Tasman bubble? Because government spokespeople said that will be reviewed next week. Was there a meeting of cabinet?
Sorry, what was that?
How did you make the decision on the Trans-Tasman bubble? When
it was one of our cabinet delegated cabinet ministers' meetings.
When was that?
I believe it was Wednesday or Thursday. One of the reasons that we're announcing it today, firstly, is to allow people to participate in next week. We've also, just over the last couple of days, been working with Air New Zealand, particularly on making sure there are flights that are available for people to book and therefore be able to participate. So that there was just a little bit of work being done on that in the last 24 hours or so.
I also ask, is New Zealand inclined to take up the Chinese invitation to join the CPTPP?
Well, we're already in it. Yeah, look, I mean, we welcome any countries wanting to join in a high-functioning trade agreement, and it's not just China who's expressed interest in this. Other countries have in the past. This is a very solid regional agreement that New Zealand exporters benefit from, and anything we can do to enhance a rules-based trade system around the world, we're always happy to look at. Any country wanting to join the CPTPP obviously has to sign up to the rules within it.
What did you make of the timing of that letter to Damien O'Connor?
I don't make anything of it at all.
Do you think that New Zealand was asked because you're a soft touch to China?
No, not at all. I think that is both a mischaracterisation of New Zealand and also probably a lack of appreciation of the place of the CPTPP. It's a trade agreement that many countries around the world are interested in. Sorry, Ben, we'll just carry on. We're going to give everyone a go, though.
Do you think it's not connected to AUKUS at all?
We'll just give everyone a go. No, I don't think it is. We'll just give everyone a go.
There was a case yesterday at a Middlemore hospital patient who tested positive, and there was no link at the time, I think. Has there been a link established?
That was the answer I just gave before, so that is still being worked on.
Okay, and I guess just building on that, the fact that there's lack of clarity around that, and a lot of other, like 13 unlinked cases in the past 14 days, and still exposure events with yesterday's cases. I guess how safe is it really to go to level 3 next week for Auckland?
Well, we'll listen to the advice of our public health officials about that when they come forward, but the decision we took to make the in-principle decision was one that was based on the advice that we got. And as Dr. McElnay's already said today, there's a cautious optimism is the phrase not only used by Dr. McElnay, but used by the Auckland Regional Public Health as well. Do you want to say anything more about that?
Only that the numbers do vary, because when we get a case in that we can't automatically link, there's an intense investigation that Auckland Regional Public Health undertake, and we at the Ministry support, and we do establish those links, and then we wait to see what the next number of cases are, and we're actively working on that, and we have reduced the number of unlinked cases right down. I think the latest that I saw this morning was about 8 unlinked cases, so it's a movable feast.
Yeah, it just keeps moving. That's the point.
Keep updating it, but what we will be doing as part of our advice, we'll be looking at what that tells us, what the pattern is. We won't just look at one particular day, but we'll look at what the pattern has been and what it's telling us, and that's what I meant by my earlier comment about we've got a cautious optimism that actually the vast majority of this outbreak has been contained. We're just seeing small number of cases coming through. We are able to link them in the majority, and we actively follow up those that we can't. So that is telling us, that's giving us some cause for optimism.
Gina?
9 of the 15 cases yesterday were out in the community. Were they not close contacts of cases, or like how were they not isolated already? Why are they in the community?
Because we're still finding very small number of new cases. when we follow up those new cases, that's where we can immediately find connections. But because those people weren't aware that they were a case or that they were a contact, they may have been out in the community. And in Auckland, what we're seeing by the sorts of exposures are the things that people are doing routinely, like going to the supermarket under level 4 lockdown. So that explains why it is something that we always want to make sure is that people who have been asked to stay in isolation are actually following the rules, and we haven't got any information that they're not doing that.
And I think that's the point, is obviously if someone's a household contact, they're going to know, and they're going to know that they're isolated. We don't necessarily identify every single contact straight away, and then when we do, we sometimes find somebody who's had a contact for a fully legitimate reason. What I want to reinforce is we're seeing very little of the kind of people just getting out and about behaviour. By and large, as the Director of Public Health has said, is just people going about their business. It's just the sequencing of being identified isn't always linear, you have to go backwards sometimes.
What is the average time of contact tracing at the moment?
I'm not sure. I haven't got those numbers. Sorry.
We can get you those numbers, but our metrics are very good. Our metrics are very good in terms of the identification of the case, the follow-up of the case, and then the identification of those contacts. But for example, when we have a case like the case that presented at Middlemore becomes a new case, they've already got contacts who, up until the point that the case went to hospital, weren't aware that they were contacts of a case. And so that's where, when we look back at what they've been doing in the previous 48 hours, they will have had some exposures.
The connecting question is, are contact tracers working fast enough so that we're getting to people before they're getting out into the
Yes, and I think we can say with some certainty that is mostly, I can't say 100% the case. At the beginning of the outbreak, when we had very, very large numbers of cases, it was obviously putting a strain on our ability to meet our metrics. But as we're coming down to the smaller number of cases, then we're much more in a position to be able to do that.
Shouldn't it be 100% because we do have smaller metrics?
Yeah, just every now and then something pops up that you can't be. I'm just trying to make sure I don't say it's everyone, and then you'll no doubt come to me with one where it's not. And so I just want to make sure we cover that. Benedict, Mikey?
Mine is just more of a generic question.
We'll go to Benedict, was waving his hand, but he may have given up. Charlie, Mikey, and then we might finish. He just gave up at the end anyway.
Just on testing numbers, they've been slowly declining. They tend to drop off at the weekend. What do you need to see in terms of testing numbers from Auckland over the weekend to give you comfort on Monday to move it up?
I'm not sure that specific number will be a major consideration on that. The overall vaccination rate increases have been good. What I would say is this weekend represents a really great opportunity for Aucklanders to get out and be vaccinated. All things going well, we'll confirm our decision for them to go to alert level 3, and maybe a way of thinking about what we hope will be their final weekend in alert level 4 is to use it to take up one of the many, many spots that are available. We've got the buses going out. We've got community testing centres open. Community vaccination centres open. There is no limit on people to go out and get vaccinated in Auckland this weekend.
The question was testing, though, not
was it testing? Sorry.
Yeah, testing.
I want to talk about vaccination. I don't want to talk about anything else.
But not the answer.
It's public service announcement day. Apologies. So say it again, Charlie, and we'll just pretend that never happened, that last bit.
Testing numbers tend to drop off, but what do you need to see from Aucklanders, to give you some comfort on Monday that there isn't any cases lurking around in the community?
Well, look, testing numbers are very important when we make our decision about alert level changes. Look, we do obviously want to see testing rates continue, and they have been very good through this week. The call that we've had by naming the suburbs that we did has borne fruit, and we're seeing more people testing in those suburbs. And so we want to see a continuation of the very solid trends we've had. We don't set a number on it, but we do want to make sure that it stays high.
Have you received any advice from Treasury or anyone in regards to whether the Debt Management Office needs to increase its debt issuance forecast in light of the Delta?
I have not had any advice about that at all. I'll just take Mikey and Jenny. Jenna, I need a cup of coffee.
Just a question, Deputy Prime Minister. Obviously, we're nearing the end of Te Wiki o Te Reo Māori, so I wonder what your words of encouragement, advice are to all New Zealanders to keep up the momentum of Te Reo Māori for the rest of the year.
So kia kaha Te Reo Māori for the whole year. It's been a really good Te Wiki o Te Reo Māori from my point of view. I've observed a lot more people having a go. As I've said before, if a guy from the South Island who grew up with very little Te Reo Māori around me can try and get it wrong and see people wince at my pronunciation every now and then, I think everyone should have a go. And the more you speak, the better you get, and the better it is for making sure we reach that big goal we've got of 1 million New Zealanders being able to have a conversation in Te Reo Māori by 2040. So I say well done to everybody who's had a go. Still couple more days to have a go, and I really appreciate the effort that's been made. We'll go with...
Before you switch
Yeah, sure. We'll finish with Jenna.
Because you obviously spent a lot of time before Waitangi this year working towards your incredibly fluid, it's what it seemed anyway, speech up there. I'm just wondering whether that journey has continued for you since then, or was that something you were concentrating on over summer because you had that to do at Waitangi?
It would be fair to say that I put a lot of effort in leading into Waitangi Day, but I continue to try and use Te Reo Māori in my everyday life now. I do need to practice if I'm going to do 3 or 4 minutes in Te Reo Māori without notes. But like a lot of people, I try and use words and phrases in my daily life, and I'll keep doing that. But it's a big journey for all of us, but I hope one that everybody appreciates the opportunity to take up. Finish with Jenna.
When it comes to your alert level decision on Monday, will it come into your thinking how Aucklanders are feeling about being in level 4 for so long, and whether they can actually withstand any more of that? People are getting pretty itchy out there, and are you concerned that people are going to start flouting the rules if you do keep them in level 4 too long?
The first thing to say is we always make our decision on the basis of public health advice, and that is what guides our decision. But we absolutely appreciate the fact that Aucklanders have been through 5 weeks of this, and it is hard. And we understand that, and we thank Aucklanders for what they have done for us. We made our call on Monday at Cabinet to announce an in-principle decision because the advice we were getting was that public health felt that we were controlling the outbreak. You've heard again from Dr. McElnay today that there continues to be cautious optimism about that. So we'll take the advice on Monday, but we have made that in-principle decision, and we want Aucklanders to know how much we appreciate what they've done.
And said that new cases pop up all the time when most of us are stuck at home, we're over it and we're losing faith. What do you say to them?
Well, I say to that person, keep the faith, that what we've done in New Zealand and particularly in Auckland under Alert Level 4 has worked. Just take a look at examples close to home across the ditch where case numbers have gone much, much, much higher than they have here. What the sacrifice Aucklanders have made at Alert Level 4 has absolutely been worth it. Keep the faith, and we'll come back to you on Monday with our decision. Have a good weekend, everyone.
Thank you.
Literally just